performing the procedure of
moving up the client.
for the procedures. My name is Justin C. Custodio, and alongside with my co-student nurse, Ivan Mahala, we will now perform the procedure. For the definition, it is a procedure that involves moving a client across the bed in sections, the upper body, waist, buttocks, legs, and feet to reposition the closer to one side of the bed. This is often a preparatory steps for other procedure like linen changes or assisting the client to ambulate. For the objective of this procedure, first is safety to safely move the client on the side of the bed, and next is to prevent injury to the client and healthcare provider, and lastly is to maintain a client comfort and alignment during the procedure.
So for the safety and security measure of this procedure, first is to ensure the bed is at a safe working height, wheels are long, and side rails are used appropriately. And use proper body mechanics to prevent injury to the healthcare provider. And lastly is to communicate clearly with the clients and any assisting personnel. So for the pre-procedural preparation for this procedure first is to wash hands. Second is to introduce yourself to the clients and identify the client's identity and explain what are you going to do, why it's necessary, and how the clients can cooperate. And after that is to gather the necessary equipment, observe proper body mechanics, and provide client privacy. So, good morning, ma'am. So, kami din yung student nurse for today. So, ako din si Evan Bala and kanya po student nurse si Justin Custodio. So, may we ask po your name, ma'am? Aishi. So, good morning, Ma'am Aishi. So, nakami karon para i-move ka sa imong proper body alignment, and also importante ni para dili ka maka-experience of any pressure ulcer caused by the gravitational pull. And importante na kay para and nakaka-operate ka, ma'am, by following our instructions. And pero kung hindi ka ganahan sa mga instruction kay pwede na ka-operate ng sponsor. So, napakay question, ma'am.
Clarifications. So let us now move to the steps or the procedures. First is adjust the level of the bed and the client's position. First, adjust the head of the bed in a flat position or as low as the clients can tolerate. Then raise the bed at the height of your center of the gravity, which is our waist. Then lock the wheels of the bed and raise the rail on the side of the bed opposite to you and remove all the pillows. Then place one against head of the bed. So, nasa pillows na itong bed. Yan, raise the assuming that you've already raised the side rails and lock the wheels. Then the rationale for this procedure is this prevents the bed from moving and ensure the client's safety by preventing the falls and prevents the client's head from hitting off the bone. Then it can also protect the clients from injury during the movement. Next is assess the client's ability to help with moving and positioning. Assess the client's age, disease process, strength, range of motions. The rationale for this procedure is to help determine the client's or amount of assistance needed and ensure safety based on the client's physical condition. So, ma'am, pwede ko mag-asma? Sa edad mo? Abot sa imong kan ma'am, kaya urban mo malihok imong ma-flex urban mo imong knees, ma'am. Flex na imong kamot, ma'am. Abot sa imong body, ma'am, dira pud kay tagalisod og lihok. Wala pud tay kuan, ma'am, any current presence na sakit na dilo mga dili ka pwede mag-move, ma'am, such as back. Wala po tayo any history of surgery, ma'am, na pwede mag-open ng wounds pag-lupos sa inyo na.
So next step is to elicit the client's help in lessening your workload or our load as a nurse by doing the following. So ask the client to flex hips and knees and to position feet that they can be used effectively for pushing, and grasp the head of the bed with both hands and pull during the move, or raise the upper part of the body on the elbow and push with the arms and forearm during the move. Or the client can also grasp the overhead trapeze with both hands and lift and pull during the move. So the rationale for this is that the client participation reduces the effort required by the nurse and makes movements smoother and more coordinated.
Since
So-
there are no trapezoid grasp presents, we will do the steps by asking the clients to flex his knees and hips.
So, ma'am, ma-flex lang imo imong knees. Ma'am, ha? And then, mahawiran lang imo ning ano po.
There is one.
Tapos, i-flex lang, ma'am. And after that is to position ourselves appropriately and move the client. So, facing the directions of the movement and then assume a broad stance. Positions your farthest foot forward and to the nearest foots behind the forwarded foot, and incline your trunk forward from the hips and flex the hips and knees and the ankle. And place your near arm under the client's thighs and push down the mattress with the forearms, and tighten your gluteal, abdominal, and arm muscles. Bend your knees and keep back straight and neutral. Rock from the back leg to the front leg and back again. Then shift the weight to the front leg as the client pushes with the heels and pulls with the arms, moving the client towards the head of the bed. So the rationale for this is that proper body alignments and wide base of support prevents muscle strain and injury to the nurse. Also, it provides leverage and support to lift and move the clients effectively, and uses leg muscles and body weight for movements, protecting the back from strain and ensuring smooth transfer. So, ma'am, so i-transfer ka na mo, ma'am, ha, pa forward, then
Yes, and wait lang.
if i-move ka na mo, ma'am, kay pwede ka mag-pull para maka-move ka. So, 1, 2, 3, 4. So, comfortable lang ka, ma'am.
Then, next is ensure the client's comfort. Elevate the head of the bed and provide a appropriate support device for the client's new position, such as pillow. This promotes relaxation, proper alignment, prevents pressure points after repositioning. Next is, if a client who has limited strength on the upper extremities, assist the clients to flex the hips and knees as above. Place the client's arms across the chest, then this prevents arms from getting cut or injured and allows the client to push with feet effectively. So the procedure we did last minute was the client has no any complications in the strengths of the upper extremities. So if the client has problems on the upper extremities, we will do this procedure. Ask the client to flex the neck. Ask the clients to flex the necks during the move and keep the head off bed surface. So, ma'am, we will do now the moving up the clients up on the bed. So, since our clients assuming that our clients has problem on the upper extremities, we will now ask the clients to do the flexing of hips. Ma'am, whether natin ma-flex the hips, ma'am.
So, before we proceed to the next procedure, first is to position yourself properly and place one arm under the client's back and shoulders and the outer arm under the client's thigh. Then move the patients up on the bed. So the rationale for this is that it will support the body as a unit to ensure safe, smooth movement. And after that is to assist the patient to a comfortable positions and raise the side rail. This promote comfort and prevention. So ma'am, amo na kang i-move ha, then mag-count ni 1, 2, 3 para dili ka para aware ka.
Aliyog lang po din yung ma'am, if makain, i-push lang ninyo yung sa
So, 1, 2, 3, go. Pwede na ka mag-relax, ma'am. So, komportable lang ka, ma'am.
Then lastly is to document all the relevant information such as time, position which the client was moved, and position to which the client was moved. Any signs of pressure areas, use of support devices such as pillows, and any ability of the clients to assist in moving and turning. And lastly is the response of the clients to moving and turning if the clients has verbalized any pain or verbalize any discomfort. The rationale is this to provide an accurate record for continuity of the care.
So, ma'am, komportable lang ka, ma'am. So, natin mapansin. That's all. Thank you so much for watching.